So the COVID-19 crisis has really represented, I think, an unprecedented challenge to healthcare systems, to societies and to economies. And those healthcare systems have certainly been rightly prioritized towards treatment of the patients particularly the severe patients who require hospitalization. When the crisis first broke, I think we were onto that pretty early, and our primary focus, of course, was to ensure the security of our own and safety of our own employees, of the people inside our businesses, and of course the patients who are participating in the clinical studies that those companies are undertaking. We've moved to social isolation, as you would expect, and in fact we closed our office about a week in advance of the government guidance on lockdown, taking a view that that was the direction of travel and it was a prudent thing to do. The team has worked, I think, well remotely, and we have the processes necessary to ensure that we continue to operate the business productively. We've worked very closely with the companies, and we've been through a bottom-up budgeting exercise with those businesses to ensure that they have taken steps both to protect the safety of their employees and to think through how they can continue to operate and continue to grow value in the businesses in these new conditions. And therefore we thought in quite some detail with the companies about how they get operatives back into the lab and how they continue to deliver that work. On the clinical side, we have seen disruptions. It's not been even across the portfolio. I think it's fair to say the oncology businesses have been less affected than the non-oncology. I think what that really reflects is the severe unmet need in the oncology patients. Many of these patients are sadly at the end of their treatment options and therefore are really desperate for therapeutic options. And given that unmet need, the healthcare systems rightly prioritize those patients, and it means that those studies have been somewhat less disrupted. In terms of sort of evidence behind that, Autolus have continued to dose patients in their Auto3 study, and we saw post the year end the first dosing of Achilles' melanoma patient. For the non-oncology companies, I think those delays will be longer, and as we see economies and healthcare systems come out of lockdown conditions, clinical trial activity is certainly resuming, and so we would expect it to resume, but with a slightly slower cadence for the non-oncology companies than for the oncology companies. We're confident that in the long run, of course, the unmet need that we focus on in our companies will remain. Societies will emerge from COVID, and we're seeing enormous efforts being made towards generating a vaccine and towards generating therapeutics, with the establishment of testing, contact tracing and isolation. We're seeing levels of control that will allow societies to move back to more normal conditions. And in that environment, the unmet needs that we focus on will still be there, and we think that our businesses will continue to be well positioned to deliver potential therapies for those unmet needs. In terms of the impact, we don't currently think that there will be any impact on the valuations of our privately held companies. We're holding these companies with very long-term horizons consistent with our strategy, and within the context of that time frame, we don't think these delays will lead to require us to lead to write-downs in the valuations of those companies. All in all, then, it's been a really remarkable time. I think the Syncona business has adapted well to the new conditions. Of course, we reference again the balance sheet that allows us to continue to support our companies and provide resilience to them through these delays. But we think that long term we will be able to navigate these conditions and are positioned well for continued growth in the portfolio.